We started this conversation last week, didn't we? The experience of people in the public healthcare system. Remember, we spoke to Abraham last week, who'd been waiting at Mitchell's Plain Hospital for more than 12 hours before he picked up the phone and called us, saying that he's been unattended, left to his own devices. He suspected he had a stroke. He had been waiting. We then spoke to the Western Cape Health Department, saying that there is a crisis in South African public hospitals, all got to do with cost. But it was this hellish experience in Helen Joseph Hospital in Gauteng. It was documented on social media by journalist, erstwhile colleague of us here at Primedia, Tom London. And it's come to no surprise to many, many bodies, including the South African Medical Association. They've raised the alarm for years now about the state of healthcare in South Africa, particularly in Gauteng. This is Tom London's experience. It's about a 5-minute video. We've truncated it to just under a minute. This is Tom's experience.
I was rushed here on the 25th because I had pneumonia. Went to my GP, treated me. Treatment didn't work. And as my antibiotics ended, I went into respiratory distress. I then got a doctor who never introduced herself to me, had very little to say to me, and then a few days later told me that she was being rotated to another hospital. No doctor, I haven't seen one doctor walk up to a patient in our ward and go, "Good morning, Mr. So-and-so, how are you?" Nothing. They treat the patients with absolute disdain and disrespect. I'm talking about this from the young Wits medical students all the way up the chain at this hospital. I have never seen a level of disrespect for human beings like this in my life. No doctor here calls you by name. Every doctor here assumes you're a hobo that's come off the streets. The doctors here are behaving like the patients are their little experiments.
It's not just Helen Joseph Hospital that has experienced issues. Public healthcare facilities in Gauteng making headlines across the recent years. Remember, in 2022, there was the letter by Dr. Tim de Meyer to the administrators of the Rahima Musa Mother and Child Hospital. When he left as the health ombudsman, Professor Malekopuro Makgoba concluded a 7-year tenure by writing a report that says, "You have the best province run by Mickey Mouse. What can you expect? A service that is in shambles." Dr. Mvuyisi Mzukwa is the CEO of the South African Medical Association. This doesn't come as a surprise to you. For years you've been talking about the shocking state of healthcare across South Africa, but in Gauteng specifically. Mvuyisi, good morning.
Good morning to you and to your listeners, and thanks for having me. Just a correction there. I'm the chairperson of the board, not the CEO.
I understand.
Yeah.
Tom, of course, has a profile of being known to the public. He also has a platform on social media. Stories like this is not unique to Tom London, who found himself in Helen Joseph Hospital. This happens to thousands, if not millions, of South Africans who have to approach a public healthcare facility for some form of attention. Mvuyisi?
Yes, thank you so much. I think what Tom raises there is a couple of issues, but it relates to his experience or experiences, that patients are subjected to in the healthcare system. But like you said in your introduction, we've always been raising these matters, including the letter that was written by Tim de Meyer, and also like the report after report, by credible institutions like the one of the health ombuds, and they're raising similar issues like that of Tom. But he also speaks about the attitude of healthcare workers. And I just want to say that, he mentions one doctor there, that also there's a Dr. Pillay who was apparently doing well or attended to him very well. And I think, there's many of those Dr. Pillays that are out there, but there are also a significant number of those that would, don't have, the required attitude towards the patient. But also, this is made worse by the conditions that, healthcare workers are working under. Because like we reported in the past, you don't expect a doctor who's been complaining about the working environment to be in their good state of mind, to be able to deliver that, because that person is experiencing a burnout, is experiencing frustrations as well.
Mvuyisi, when we spoke about this issue last week and the experiences here in the Western Cape, we had one or two doctors call in and say they are experiencing compassion fatigue. There are millions of people who experience this on a daily basis. Their limit of being able to care is only so much. And after a level, they feel, as you said, they feel under pressure. They feel that they cannot care more. Experience the level of compassion fatigue by healthcare workers in the South African public system.
This is a great problem because, what's frustrating about this is because you get a report after report pointing towards the same thing, but you don't see different results. Instead, people are talking about now introducing the national health insurance. How do you introduce NHI when you do not have ethical leadership and governance? How are you going to implement it? These are things that we're saying you can't attend to one pillar of a healthcare system and neglect the other pillars. We've been insisting on this, and nobody seems to be listening, to the fact that you can't have a reform and you're only specifically looking at one aspect, and that's the financing aspect. And you forget about the most important ones, in terms of ethical leadership and governance and the issues of, staffing in the institutions. So those are matters that, needs to be attended to urgently.
What Tom also mentions, which we couldn't play in the 5-minute video, is also about infrastructure. He's talking about waiting in a room for 3 days and only on the third day receiving a blanket, going to a bathroom and a small thing of having toilet paper available is not there. This all comes down to budget. This all comes down on how do we fund a public healthcare system. Let's put NHI aside at the moment in a period where we have, in real terms, budgets for health going down. The department would say, well, in fact, they're increasing, but in real terms, it's actually going down. How are we expected to have a public that is confident that the national health insurance is going to work for the majority of South Africans, Mvuyisi?
Yeah, the problem with the health budget, it has been going down, like you said, it has been going down. But the other problem is mismanagement, and also poor planning. If you, for example, if you have institutions or infrastructure that when it has to be maintained, you've got to approach another department in terms of public works. Then you have, all these fragmented approaches to, maintenance of hospitals. Then it becomes a problem. And then you've got to follow all these tender processes where you've got to allocate 5% to the rural women and 5% to that. So there's many of these things that fall outside of the healthcare system. It has to be unified. We must stop the fragmentation, but we must attend to the issues of ethical leadership and governance as well.
Dr. Mvuyisi Mzukwa is the chairperson of the South African Medical